I want to get started and introduce our next speaker. I'm really, really fascinated with this, our next talk, because I work in psychology and I haven't met many psychiatrists who are really open to the paranormal. And yeah, so I'm going to give a lot of referrals to you, John. So our next speaker, Dr. John Webber. Dr. John Webber, he is a psychiatrist who lives and practices in Melbourne, Australia. After graduating with a medical degree from the University of Melbourne, he then completed his psychiatric training and is a fellow of the RANZCP. He has spent more than 3 decades in private practice, with his work including mentoring and supervision of young psychiatrists. He is the author of The Red Chair, which is available on Amazon, Book Depository and Booktopia. And I'm halfway reading through that, John. I'm up to the bit where you're about to do the regression on Judy. So anyway, John is going to talk about a psychiatrist's discovery of parapsychology and past life regression. Well, yeah, take it away, John.
All right. Thanks very much, Joyce. And I trust you can hear me okay. Let me know if there's any problems with the auditory. And Joyce, thank you, and the Institute for inviting me along. Here's a copy of the Red Chair, just to people that Joyce was mentioning. And in my talk, I'll talk a little bit about some of the issues in the book and the characters in the book, but also some of the regressions and events that have happened since then. So it's had a big impact on me. I thought I'd start just by quoting William James, who's considered by many people to be the father of modern psychology in 1902, and it's just a lovely quote. And he said, "Our normal waking consciousness, rational consciousness, as we call it, is but one special type of consciousness, whilst all around, parted from it by the filmiest of screens, there lie potential forms of consciousness entirely different. We may go through life without suspecting their existence, but apply the requisite stimulus, and at a touch, they are there in all their completeness. No account of the universe in its totality can be final, which leaves these other forms of consciousness disregarded." And I actually just really love that. And of course, William James wasn't the first to consider all of those kind of ideas of parapsychology and consciousness going beyond our brain. You could go back to Plato and Socrates, and that would be, and probably before that. So, as Joyce said, until 12 years ago, I would have comfortably dismissed, probably like most psychiatrists, any talk of psychic or metaphysical phenomenon. I'd just be saying it was baloney. Yes, I'd completed my medical degree and completed my qualifications as a psychiatrist, and then I'd been in practice for about 20 years. And I was very attached to traditional medicine. If modern medicine couldn't explain it, if modern science couldn't explain it, then as far as I was concerned, it didn't exist. It could be dismissed. Then 14 years ago, about 14 years ago, I read a book called Many Lives, Many Masters by Brian Weiss, a psychiatrist. Now, I wouldn't have normally read something like that, but my daughter gave it to me and she made me promise that I'd read it, which I did. I was on holidays, and it had it was extraordinary. It had quite a profound impact on me. He was a well-credentialed psychiatrist, the chairman of the Department of Psychiatry at Miami University, connected to the Mount Sinai group of universities. And he had a very difficult patient, and he was exploring the difficulties with this patient and using hypnosis. And he would use hypnosis to try and go back into her childhood. But when he said to her, "Go back to when your problems began," she went into a past life. of centuries before. And that was, I'll just, okay, sorry. And that was, he was completely dumbfounded. He couldn't work out why she'd be talking about a lifetime centuries before, and to start with, he didn't believe it. But eventually, he came around to the idea that it was real. And the significant thing for him, which he writes about in the book, was that it had an extraordinarily positive effect on the patient. All her phobias and her physical ailments just resolved. So it was quite lovely. And at the same time, my son-in-law Sam came to me, and his brother had died not long ago from a brain tumor, and he was very sad about that. And his brother had left him a car, and the car was just a wreck. But Sam didn't know what to do with it. He felt obliged to have to keep it. Anyway, because of his distress, his mother, who was a little bit spiritual, said, "Why don't you go and see this medium? She's lovely." And so he did that. He rang up anonymously. She didn't know anything about him. And when she started talking to him, she described this young man that was standing next to him, and then started describing the personality of his brother quite accurately. And then, after about 5 or so minutes, she said, "Oh, he's telling you to not worry about the car, to get rid of the car." And for him, that was just ridiculous. How could she possibly have known about the car and all the elements that were going on? So he just thought that was extraordinary. Then another 10 minutes later, the medium said, "Oh, now he's saying Timmy or Tim, and he's laughing. Does that make any sense to you?" And Sam said he and his older brother, the older brother and the brother that had died when he was younger, used to call him Little Timmy, and they'd laugh at him. And there's no way that the medium could have known that name and known the humour that was attached to it. So I was, after reading Brian's book and that, I started to get really interested. So I began reading voraciously, and I read more books by Dr. Weiss, and I even went to one of his workshops when he first came out here to Australia. I always remember the one that struck me was when he told the story of the Chinese surgeon who couldn't speak any English, but she was desperate to do a past life regression, and so she went to she actually organised an interpreter. Not easy when you're doing hypnosis, I might add. But the interpreter was there, and so Brian did the hypnosis, and not surprisingly, she was a good subject. Then she went into this past life that was English, and he started speaking English. The Chinese surgeon started speaking English. The interpreter was so sort of blown away, he started interpreting the English back into Chinese, which was not helpful for Brian, I can tell you. He told the interpreter to stop that. But it was remarkable that this person who couldn't speak any English suddenly, in going into that past life, was talking English, a phenomenon we now call xenoglossia. And things like that, again, were things that I just couldn't ignore. Then I read a book called Old Souls by a journalist who followed Ian Stevenson. I suspect a lot of you probably know about Ian Stevenson, a child psychiatrist who worked at the Department of Parapsychology, Virginia University, and he studied young children who talked about their past lives. In the end, some 3,000 children. And I've read his books as well, and he is scrupulous in his approach. In fact, so scrupulous, some of his books are hard to read because he's so careful. He would interview the children, he'd interview the families, and then would investigate the possibility of that past life. And in several hundred cases, he was actually able to verify the details of the life the child was talking about, which is just quite extraordinary. And again, that's the sort of stuff you can't ignore. He also, and this is really interesting, with some of the children, he discovered that they had birthmarks. And the birthmarks, when he was able to verify the past life, the birthmarks would fit with the cause of death in that life. So a good example of that was a woman who'd had gone into a male life where she had, and the child, sorry, I'm confusing it a bit. The child had an area of depigmentation in the centre of the chest, which had never been explained. But when Ian Stevenson found that lifetime, discovered that the person had died from an accidental gunshot wound to the chest. So it made sense. Now, how that transmits to the child and how the child carries that through to another life, I've got no idea. But that kind of thing was just completely extraordinary from my perspective. And I read about individual accounts of people's past lives. You know, Jenny Kukel, her book Yesterday's Children, James Leninger, his parents writing a book about him, and which I think is called Soul Survivor, and lovely books. But the details, again, it's just very hard to step back and ignore these, where they were able to verify the lifetime that they had previously lived. Now, at the same time, I read about near-death experiences, and again, something that I had been completely dismissive of. Sadly, as a doctor, people had come up with near-death experiences, and I've unfortunately always gave that little time in the consultations. But then I read works by Jeffrey Long, Bruce Grayson, and then eventually even Alexander, his book Proof of Heaven, and I'm sure you're all very familiar with descriptions of near-death experiences, and Carmel will be talking about that subsequently. But here are people who've often have no heart function, no identifiable brain function, and yet have profound, detailed experiences, often leaving them observing events around them, and what is often recounted as a heightened sense of consciousness and sometimes a profound spiritual experience. Doctors and scientists, again, just inclined to dismiss those findings, stating that, you know, there must have been some residual brain function, even if there was absolutely no evidence to back that up. Not everybody, of course, that's the case, but in a lot of cases it was the case. But it's in the end, when I was looking into it and researching it, it was really what we would call the veridical near-death experiences that can't be explained, where people's consciousness has left their body and observed events or details that just quite simply can't be explained from their unconscious or dead state. A good example of that is one of the ones that Jeffrey Long wrote about, where a woman ended up in an emergency department. She was completely blue, unconscious, had no heart function at all. And so they attempted to resuscitate her. So they were trying to intubate her. And in the process of trying to intubate her, they found that she had dentures. So they had to take the dentures out and continue the, whoops, who have I got now? I'll switch to gallery view. So and in that instance, she recovered, and not many people do recover from those types of resuscitations. Not many people do, but she did. And about 2 or 3 days later, she said, "I need my dentures. Where are my dentures?" And they said, "Oh, look, sorry, we've got no idea where the dentures are." And of course, she'd floated out of her body. She'd observed the whole thing, and and she said, "Oh no, I saw the person take the dentures and put them in the drawer of a trolley nearby." So off they went and back to the emergency and checked out where the trolley, and yep, there were the dentures in the drawer, just as she described. So for me, things like that are fairly extraordinary. They're not explainable in terms of current science and in terms of in current medicine, but that doesn't mean it doesn't exist. So I was, I just found all of this kind of thing hard to dismiss. And then I read up the areas that you're interested in, which is areas to do with psychic phenomenon, and read up on Dean Radin, also at the Virginia University, and his double slit experiment and how consciousness changes outcomes. The impact of consciousness on random number generators, and then the evidence related to precognition and remote viewing, all of which for me was new and lovely and exciting. At the same time, I was reading about mediums, Laura Lynn Jackson, John Edwards, and as well as that, I started listening to my patients. I'd always previously just plain ignored them when it came to psychic phenomena. I even started asking them if they'd had psychic experiences, and of course, that opened a floodgate of things for them. So one of my patients, for example, had seen John Edwards very early on when he came out here many years ago for the first time. He wasn't as popular then, so it was at a smaller venue. Her husband had died 6 months earlier, and so she decided spontaneously to go along. And John Edwards, not only did he get the name right, he then got the name of their dog right, who died since the husband had died. And then there were about 6 different things that were very specific, not general things, very specific things related to the husband and events since he died. And for her, that was just quite profound. She just simply couldn't ignore it. And for me, again, quite profound, and I couldn't ignore it. So I really didn't need any more convincing. And my interest, having read Brian's book, was in reincarnation and the use of hypnosis and past life regressions to explore that. Now, as it happens, I had hypnosis skills, which is a bit unusual for a psychiatrist. I'd been at the Austin Hospital when there was a workshop by the local Victorian Hypnosis Society, and I'd joined in on that. So I'd had that. I hadn't used it a lot with my patients, so it was. So I needed some practice. I skilled up on my regression techniques and finally decided I was ready to start doing some. But I didn't want to do it straight on patients. I thought, that's a bit dodgy. So I had a friend of my wife's said she was quite curious, Jenny. She'd always wondered about past lives, and she thought that would be fun. So we, as it happens, she was a fantastic hypnotic subject. I've decided that nothing is coincidence anymore. So she was a brilliant subject, and she would go into a really deep trance state. And over six sessions, because we were enjoying it so much, we did 6 sessions. She went into numerous past lives. None of them famous, I might add. All the people that don't like the idea of it, they say, "Oh no, everyone just goes into a famous past life. Everyone was Napoleon." And well, I've yet to have anyone particularly famous at this stage. But her past lives included being a male in 13th century France, being abandoned as a newborn baby in Africa. That was a little distressing. A life in ancient Egypt, soldiering in a war between Athens and Sparta, and a life as a merchant in China. In that one, she was a he froze to death. There was a snowstorm and froze to death. And that was slightly traumatic for me, because she actually started shivering while she was on the couch in that hypnotic state, remembering that experience of being frozen. She actually started shivering. And that's what was really interesting about Jenny, is that she was completely embedded in the emotions, the observations, and the details of that past life, even to the extent of starting to have a physical reaction to it. So it was quite extraordinary, and there was just no sense that it was contrived or imagined. Now, in addition, Jenny would, at the end of the lives that she would go to, sometimes she would then describe going into leaving the body, floating out of it, just like people describing their near-death experiences. And she would describe going into this lovely sort of spirit state or spirit realm, whatever you want to call it. And then she'd connect with people that had died in that previous life. and often would make connections with spirit guides and wise beings. So it was, for me, it was just quite compelling and quite extraordinary. Jenny loved it. She said she'd always had a bit of a fear of abandonment. So she wondered if that life where she'd been as a newborn baby abandoned and left at the side of a tree, whether that had been a source of that. And she was quite relieved having done that, not traumatized at all, just relieved at having had that experience. So I thought, no, I can use this on some of my patients if I think it's appropriate and they're well enough. If they're too sick, I don't think they're in the space to do it. But if they're interested, so the first patients that I considered it on were patients who'd actually had near-death experiences, and they were naturally interested in psychic phenomenon. So one of them had had a near-death experience during an anaphylaxis, and then there was Jane. She'd had a heart attack and an arrest and had a near-death experience. And again, the doctors that had treated her when she described what had happened were pretty dismissive of it. And to be honest, that's what I would have done when I was a younger doctor. So she was, when I said, I believe you, I believe what happened, and I'm sure it's real, she just burst into tears because nobody had affirmed that for her before. So both of those patients agreed to do the hypnosis and the past life regressions. Now where am I up to? And in both cases, they suffered from quite severe anxiety and depression. In both cases, they were still on medication and receiving therapy. And the regressions for both of the patients proved really, really helpful. Both came off their medications, and this wasn't a short term. Both of them have stayed off their medications long term. I've caught up with all of them years later, and they're all doing really well. So it's really quite lovely. I'll give you an example with Jane. So what I say during the hypnotic state is, I might say something like, when they're in their deep trance, I might say something like, now we're going to go back in time, and I'll describe a doorway that they can pass through, and that when they go through the doorway, to allow their subconscious to choose the time, whether from this life, a previous life, or between lives. Now, when I did that with Jane, for example, she then, the first one we did, she then went back to a life where she described living in a house with big white columns. She said it's America. She was outside in the veggie garden picking vegetables. She was in a long white dress. She said it was neck down to her feet. And again, these are, when the patients are really deep subjects, they're kind of spontaneously describing these events and these memories. And she said it was very, very hot, extremely hot. So she went inside, and inside there was the cook. And the cook told her off for being outside in the heat. And that was because she was pregnant. She was early in her pregnancy. And I, for whatever reason, and sometimes I used to forget to do this, but in this case, I remembered. And I said, do you know what the date is? And she said, oh, it's 1878. And she said, I know that because it's my 20th birthday today. And that's why the cook's here. We're having a party tonight. All the friends and family are coming over and we're having a lovely big party. It's my 20th birthday. So I wanted to be a bit more specific. So in that case, I said, oh, well, where is this? Where are you living? And she said, Cape May. And I thought to myself, well, I've got no idea where Cape May is, but, you know, terrific. Okay, that's good. Anyway, I then took her forward and said, look, go forward to another important time in that lifetime. And she said, spontaneously said, oh my goodness, there's been a huge fire. You know, most of the town has been burnt down. We're fine. Everything's okay because we live in an estate just out of the town of Cape May. But we're helping friends whose houses have been burnt down and people whose businesses have been burnt down. My child's just been born, all of that kind of thing. And I went, okay, all right. She went through the rest of that life fairly, you know, her brother died from consumption. Her daughter grew up and married and started looking after the estate. Now I was having a busy day that day, so I didn't have a chance to do anything. And when I got home, I have to say, I did ask Jane at the end of the session, I said, have you got any idea where Cape May is? And she said, oh, I don't know. If it still exists, I wouldn't have a clue. Anyway, and nor did I. Anyway, I was home, and my wife and I were having dinner with my brother and his wife that night. And I was recounting this because I was pretty cock-a-hoot about it. I thought it was fairly extraordinary. And so my sister-in-law jumped up off the table and went up to the computer and typed in Cape May. And as it happens, in 1878, in Cape May, a third of the town was burnt down by what was considered to be a deliberately lit fire. So that's probably the closest I've gone to a verifiable past life that one of my patients has gone into. But nonetheless, I thought it was fairly extraordinary. And again, I'm sure it was part of the message for me to keep doing what I'm doing. So then I had my third patient who'd had a near-death experience was Judy, and she, again, after years of treatment, had little benefit. I'd been seeing her for nearly 20 years, and having practiced for as long as I have, you do collect some patients that are very unwell, and she was one of those. I started seeing her when she was 32. At the time, she was married with a 6-year-old daughter. She'd seen a number of psychiatrists before me, and had been hospitalised on many occasions. So I started seeing her following a dangerous overdose. And Judy just had the worst upbringing you can imagine, just awful. She was the 7th of 8 children. She was badly abused by a number of her older brothers. And for that 20 years, I'd been treating her rather unsuccessfully, I have to say. She'd had regular therapy, numerous hospitalizations, numerous different medications, had ECT on a number of occasions, not just me. I'd done that on a few, and on other occasions, she'd been admitted to public hospitals and been given ECT. And she'd taken a number of dangerous overdoses. So to be honest, she was lucky to be alive. I mean, that's the truth of it. We'd now say that she had a chronic complex post-traumatic stress disorder, and certainly with periods of quite severe depression. So I was nervous about trying a past life regression on her, but I have to say, I thought, I've got nothing to lose here. And I don't think she does either, because she was so unwell. And her near-death, I have to describe her near-death experience just to give you perspective. She'd suffered from an illness called Guillain-Barré, which paralyzes the muscles. And when it's severe, it can cause paralysis of all of your muscles, including your respiratory muscles. And that happened to her. So she ended up in ICU on a respirator as a consequence. And while she was on the respirator, she floated out of her body and looked back down on the body being breathed by the machine. And she said it was just quite lovely and peaceful, which was unusual for Judy, I have to say, because most of her life wasn't. And she said there was this gold light that came over her left shoulder. And the gold light said to her, it's not your time. You have to look after the kids. Now, when I ended up finally seeing her again, which was many, many weeks later, because she had to recover from she said she didn't quite understand why he said kids, because she only had one child and she'd already had an endometrial ablation, so she wasn't going to have any more children. But as it happened, her 16-year-old daughter was pregnant a year later, and Judy's been very busy looking after the grandchildren as well as her daughter. So all of that came true. Anyway, so that's Judy, and she's a really colourful character. She's an unusual. She's the main character I write about in the book, and it's worth a read because she just is very colourful and quite an extraordinary character. But I thought I've got nothing to lose, so I started the hypnosis. And to start with, I just did hypnosis to help her stop smoking, and that was successful. Again, she was a terrific subject. Nothing's coincidence as far as I'm concerned. A really deep subject. And then I used it to help her stop the heroin. She used to use heroin semi-regularly, and that was successful. So I thought, right, I'm going to do a past life regression on her. And lo and behold, she went into these past lives. The first two were lives in America in the 1800s. And then I did another one. She really enjoyed them. For her, it just gave her a whole new perspective on things. Her next one was a life as a Frenchman who was eventually shot and killed by German soldiers for hiding people under the floorboards of his house. She went back to this male life. And it was fairly traumatic because not only did he get shot, but his wife got shot and the children got shot. So all of that was, and I was, to be honest, when she came out of it, I thought, oh my God, I've traumatized her again. She's had enough trauma in her life. But that wasn't the issue. She after the hypnosis, she opened her eyes and she looked at me and she said, "What the fuck? You didn't tell me I could be male." She had just completely assumed that every past life would be female. She hadn't even thought about the possibility that she could be male. So I actually start the book with that quote because it was one of those lovely, humorous quotes, and she is colourful, but she just didn't expect it. In other regressions, Judy went to lives in Spain, another male life, and England, and like Jenny. My guinea pig, my original one, Judy would often go to the end of the life and describe leaving her body and feeling the peace that would come over her. And in that spirit state, which is what I call it, call it what you like, she would often meet up with other beings. Again, that might be family members who died in that previous life that she just remembered, or spirit beings or guides. And often there was a spirit being with that gold light, the one that she'd experienced when she had the near-death experience. And that was remarkable because she'd start communicating with that gold, that being. She'd call him Goldie, and she called him a him. She said he's not really a him, but she called him Goldie for want of another name. And he would give her advice about her current life. So this is all, I'd have done the past life regression. She'd have gone through that lifetime. She'd then leave the body, go into that spirit state and start talking about connecting with these spirit guides. And in this case, often with Goldie. And he'd give her advice and sometimes would give her information about future events, which remarkably then proved to be accurate. So again, for me, it was pretty compelling. I haven't got time to go into all of the detail, but in the end, it had a really positive effect on her, and it was over time. We didn't do it all at once, but we did it over time. In the process, it was so powerful, some of those spiritual experiences, that she ended up being able to forgive her abusive brothers, which for me, she said, I'm not scared of them anymore. I can, in her heart, I'm able to forgive them. And for me, that was just quite profound. She said she didn't want to have anything to do with them, I might add, but she was able to, in her heart, forgive them, and that she was no longer afraid of them. And that was just lovely. And over time, we're able to reduce her medication, and she hasn't needed psychiatric admission to hospital for over 10 years. So the effect on her was just lovely. And I think the regressions, the reason they had that positive effect is that it just made her feel that there's just way more to us, that there is a life after death. There's past lives and probably future lives, and that our soul or our spirit is our true self, and that we are all connected in ways that we can't explain. And I'm summarising, but I think that's why it had such a profound effect on her. Now, I've continued to use past life regressions with patients when I think it's helpful. Like I said, if they're too sick, that's not the time to do it. But if they're a bit more settled and they're interested, then I've continued to do it. And I haven't had any negative responses. I haven't had any adverse effects. to date, which for me is really encouraging. I mean, that's so. I don't think there's any significant risk attached to it. In fact, the only negative effect is when people don't go into a past life, which is probably 50% of the time. Not everyone does. So if you do it, it's probably 50-50. And so if there's a negative side, it's when people don't go in there and they get frustrated because they're really hoping that it would happen. I did, for example, I had a patient just recently in the last 6 months who I did a past life regression on, and she didn't go into a past life, but she ended up somehow communicating with her grandmother and her deceased grandmother. And she was very, very close to her deceased grandmother when she was alive. So for her, that was quite lovely. And she ended up communicating with the grandma, and she said, "Am I on the right path?" And her grandmother quite bluntly said, "Nope," and which I have to say surprised me. And so she asked the grandmother. She said, "Well, what do I need to do?" And the grandmother said, "Lighten up." Which I thought was just lovely. I thought was very straightforward and very lovely. Although I did think to myself, well, I could have told you that, which was true. Having said that, the grandmother had way more impact than I did. So that was quite lovely. So I've thought about the positive outcomes and why. And I've got to be, to be fair, I've done regressions on patients where it's been quite lovely and they've been quite affected by it. But it hasn't had any profound long-term effect in some cases. So I'm not saying this is the panacea for everybody. It's not the cure-all, but in some cases, it's really had quite a profound effect. Some of them, they go into a past life, fantastic, terrific, lovely, but their illness or their issues in their life take over again. And while they've got that understanding, life is hard and it still goes on and it's difficult. But for some, it really has a really lovely, prolonged effect. And I've thought about what it is that and why that is. And I think the first is that it simply reduces for some people their fear of death, which for a lot of people can be quite powerful. And I think in the same way for some people, it really does ease their grief. So if they've had a loved one who's died, it's really quite comforting to contemplate the idea or know that person is still with them at some level, just on the other side. Now, for others, I think it's the understanding that there's just much more to us than simply this body and this life, and that our true self, our spirit, is something far greater. It takes the pressure off having to get everything right in this lifetime. And there's something quite lovely about that, because if you think this is it, we've got one life, it's all over, it's done, then there's this enormous pressure to get everything right and that, I think for some people, it's really quite liberating. It's like way more to us, and they can look at things quite differently and be kinder to themselves. Some people go into past lives that give them a much greater perspective on their current life, and these, I really enjoy these ones. I'll give you an example. Tobias, Tony, for example, went back to a life where he was a woman centuries ago. And it was many centuries ago, because he described knights on their horses and jousting and the like. But in this lifetime, he was incredibly poor. The woman had lost her partner or her husband, had 2 young children that were poverty-stricken, and she couldn't get employment. She had no money, so she had to steal to feed the children and to look after herself. And she was always fearful of the authorities coming after her. And that when Tony came out of that life, we just had a bit of a chat about it then and in a later session. And he said, "Oh my God, it is so helpful for me because I am constantly, he's married, he's 40, he's married, he's got young children, and he's going, I'm constantly worried about my security, my finances, whether everything's going to be okay, whether the children, he said, it is so given me perspective on all of that. So for him, that was just quite lovely. It really had a lovely effect on him. Then there's a patient, Cassandra, and this is a bit similar. And she went back to a lifetime where she was in England when the Romans were invading. And it was interesting because she said it was quite fascinating because she said initially it was lovely because the Romans brought new technology, food was better, they were better looked after and sheltered, and she said, but then whoever was in charge changed hands. So the authorities then changed to new authorities, and they became incredibly powerful and cruel and quite despotic. And so that lifetime became appalling as a consequence of the new leadership. Now, Cassandra, as it happens in this lifetime, has an issue with authority and is a little bit prone to develop conspiracy theories when she gets distressed. And so it's lovely now. I can say to her, so the Romans are back. And that's, she gets it. She understands that that's where her fears go, and she can put it in perspective. In fact, she's done more reading, and for her it's lovely. She takes it even further. She's got involved in a sort of a Buddhist way of looking at things, and she says, none of it's real anyway. It's all an illusion. So she starts getting caught up with her fears and anxieties. Not only does she remember the Romans, but she can also say, no, it's all an illusion. This is not who we really are. So for her, it's been quite lovely. Now, occasionally, the past life relates to a physical problem. And a physical problem in this life. And there was a patient, no, he actually wasn't a patient, he was a friend of a friend, Charles. And he went back, and he was again one of those people that was just really curious to have the experience. And again, nothing's coincidence. Charles happened to be a really, really good subject. So he went back into a Japanese lifetime, where he was a leader or an important figure. He might be the closest one to someone being famous. I don't know, but I don't know my Japanese history very well. And he was a leader and an important figure. And he would describe his silken clothes, arriving in towns where people lined up to honour him, then sitting in his grand chair or throne with monks around him and others sitting all around him. Now, in that life, his life ended with his temple being attacked and burnt down. And he described the stab wounds, and then the smoke, the blacks and blues and purples. And he's another one of the examples where I actually got quite anxious while he was describing it, because he started shaking all over, got quite tremulous on the red chair while he was describing this death and the smoke. And anyway, I'm kind of glad he died eventually, because that relieved me. Having said that, he talked right through it. And he was fine afterwards. And because he was a friend, I didn't see him afterwards, but I caught up with him about a year later, and he said, John, you probably don't realise, but I've been an asthmatic all my life, and ever since we did that regression, my asthma's resolved. So for me, that was just lovely, and it's an example of where it potentially has, going back into that past life, possibly dying from smoke inhalation, somehow relates to the fact that he had asthma, and now that's been resolved. So occasionally, again, another example of a dual benefit, one that's both physical and emotional. The example I'd give is Sandra, who went back to a life where she was abducted when she was very young. Again, this one was a little bit a bit traumatic for me, just simply because the life she went back to was so difficult. She was abducted when she was young. She was forced into prostitution. and even went back to a memory where she was being raped. And I could only cope with a certain amount of that, so I took her forward. Later on, she got cross with me for that because she said, you know, I wanted to see what the outcome was. But anyway, so that was remarkable. And the thing that with Sandra was that afterwards, and I'd not known this, and I had been treating her for a couple of years. She said that she'd had attacks of tonsillitis all her life since she was a child. Not sure why she hadn't had her tonsils out, but she said about once a month she would get a bad attack of tonsillitis and get a very sore throat for about a week. Now I'll leave you to connect the dots in terms of that life of prostitution and the sore throat. But after we did that regression, her tonsillitis completely resolved, and she's not had another episode of that since then. So for me, that's quite remarkable. She also said that when she was a very small child, she had always had the fear of being attacked. She was always incredibly nervous that people were going to come and attack her in some way. And her bedroom was an upstairs bedroom, but she still was convinced people would break in the house, come through the window, and somehow attack her and harm her. And those fears had remained with her to some extent into her adult life, and it beautifully put in perspective those fears. So she's been very much calmer and much more able to let those fears and anxieties go. So for me, that was a bit of a jewel. Not only did the tonsillitis get better, but her underlying fears and phobias got significantly better. Now, the last one, and definitely not the least reason for why I think some people get such benefit, and this probably applies to Judy, who I spoke of, is that the patients, they experience that past life, but then they go into that spirit state. And sometimes, as I've said, they can contact souls or other beings or wise beings. And there's something so loving and peaceful about their experience that it often stays with them and gives them a more positive perspective on how they see themselves and others. And that, I think, is just really quite profound for a lot of people. It really changes their perspective on how they see themselves and others. And it's quite lovely. Heather, for example, was a woman I saw just 12 months ago. And I'll give you a description, because the very first time I did Jenny, I didn't record it, the regression, but ever since then I've done recordings of these regressions. So all of them, I've got recordings and transcripts of the regression. So for me, that's really important. And for a lot of the patients, that's really helpful. They love reading through it again because it's quite affirming. Anyway, here's the transcript of what Heather said after she'd finished that life and left her body. She said, "I'm no longer restricted in a small body. I feel like I've expanded. I feel light. I keep thinking of forgiveness, of me and everybody, forgiveness of everyone. I feel like I can celebrate that life that I had. I feel loved. The love is overwhelming. There are so many beings. The love is overwhelming. Everything is as it should be. No one is doing anything wrong. What we don't understand is that we are perfect as we are. I feel like it's so clear." And that was just delightful. And I've had similar ones where they describe it like that. And now in Heather's case, and this maybe you could argue is a downside, she said it took her about 3 days to ground herself again. She said that was just so extraordinary for her, so lovely. She just almost didn't want to get back to being human again, and with all the contrast and all the stuff that we have to deal with. But in the end, obviously, it had a lovely positive effect in the long term. So I thought I'd finish on that note. I thought that was a really lovely transcript. So they're my thoughts. And obviously, I'm not doing regressions on all my patients, but when I feel like it's appropriate and people are interested, I think it's a really positive thing to do for some people. And I hope that gives you some idea. I'm not touting for patients. Trust me, my books are closed, so that's what it's not all about. And there's no money in selling books these days. So, but if you want to read the book, it's a good read, and there's a lot more detail in that, and some interesting facts. So there we have it. I could talk on forever. I love talking about near-death experiences. I love some of the psychic experiences of my patients are lovely. Carmel's going to talk about her near-death experience, so that'll be lovely. Anyway, I'll stop there. And any questions?
Thank you so much. Yeah, thank you so much, John. That's so profound. Yes, there's lots and lots of questions.
It's no, you're absolutely right. I think psychedelics will inevitably be part of our treatment regime in the future. I just don't think that can be ignored. The evidence is quite compelling. Particularly whether it's LSD or psilocybin or MDMA, they all have. And in a lot of those cases, not all of them, again, I think the psychedelics will be really helpful, but they won't be the panacea. Some people tout it as if it's going to be the solution to all things, but I'm sure, and people do in those cases have lovely, profound spiritual experiences, I think, which stay with them. A lovely example of that was the policeman who turned up at Port Arthur. So he was the first policeman to turn up at Port Arthur, and of course that would have been
the massacre you're talking about.
Yeah, the Port Arthur massacre, and that would have been just completely terrifying. Or there were all these dead bodies. He didn't know where the gunman was, so at any point he could have been shot. And he went into the cafe. One of my patient's husbands, I looked after her husband, was shot in the cafe, so it's kind of close to my heart. But he went into the cafe and saw all of these people who'd been shot and killed in the cafe. So he unsurprisingly developed quite a bad post-traumatic stress disorder. And he tried everything to treat that. Now, in the end, I think it was psilocybin. It might have been MDMA. He finally went and did that. And during his experience of that, he took himself back to Port Arthur and going into the cafe, and he could see. And this was his description. He could see the souls of the bodies comfortably leaving the dead bodies. And for him, that was just quite profound and quite curative by the sound of it. So yes, I think that's why, in the same way as the regressions, they give people a perspective, and I suspect the psychedelics will be doing that. So if you talk to the people who are supporting, and there is a group in Melbourne that are trying hard to get psychedelics to be acknowledged and possibly treated. So, which is lovely, because there's been great research, the Johns Hopkins University, New York University, and the Imperial College in London, really good evidence that can be quite powerful. But they tend not to talk about the spiritual effect, because to get funding for research, you've got to kind of make it chemical. You've got to make it, you've got to make it a little bit organic. So they tend not to talk too much about the spiritual effect, but I think it's the spiritual effect that is exactly the thing that's curative. What's interesting, when David Nutt at the Imperial College, they looked at the MRIs of patients who were under the influence of psilocybin, and they expected the MRI, a functional MRI. So they're actually looking at the brain working at the time they're under the influence of, and they expected, because of the beautiful scenes and things that people experience, they expected the MRI to light up, to be all of this brain activity. And it was the exact opposite. The brain actually shuts down under that influence, and it's like it shuts it down, allowing access to these other levels of consciousness. So for me, that's just another sort of confirmation. So good question. Thank you.
Thank you.
Look, a really good question. I've actually avoided doing it on any patients who've had psychotic phenomenon. So schizophrenia or if they've had psychotic depressions or manic psychosis. So I'll avoid that pretty much completely, because I don't want to, just a bit nervous about that. And as I said, if the patient's too unwell at the time for whatever reason, I don't go there. So I need to feel that they're reasonably settled before I'll do a regression. But beyond that, it's a bit the pants stuff, Terry, as you're implying. I mean, I've got fairly good experience, and most of them, I need to feel like they're very willing. So I need to feel like they're up for it and curious. Sometimes I'll get them to read my book or Brian's book or something like that, just to see how they react to that, and have discussions around that. So there's a few factors that determine whether or not I think they're suitable. Certainly not.
Regression.
No, absolutely not. No, there's that's not. That was just me when I first started. They were the people that by virtue of their near-death experiences, they had a spiritual perspective. So I didn't feel like I was forcing anything upon them.
Okay.
So they were all very, very interested. I think people are more open-minded these days than we think. I gave a similar talk to this, maybe a little bit more clinical, to an academic forum of psychiatrists, now probably about 18 months ago. And you won't be surprised that I was quite nervous to do that. There are a few professors there and the like, and a bunch of colleagues. But it's even the chairman said at the end of it, he said, wow, I'm going to have to go back and have a rethink. So, which is lovely. And one of the psychiatrists got up at the end and said, well, we're scientists. And as scientists, the fact that we can't explain something doesn't mean it doesn't exist. Which I thought was just perfectly put. He then actually, and I'll tell this story because it's a lovely one, he then described a patient who'd had a near-death experience. He'd had a blow on the head and had an extradural hemorrhage, which is a bleed on the surface of the brain, which requires emergency surgery. And he'd gone in and had the emergency. And while he was in the operating theatre, obviously deeply anaesthetised, eyes taped, having the operation on his brain to relieve the blood, he floated out of his body and could look back down on what was happening, the nurses, the surgeons. And he said at one stage he saw the surgeon pinch the nurse's bottom. And it was like, whoa, okay, unacceptable for starters. But anyway, as it happens, this guy made he made a full recovery. He was telling his psychiatrist, and he eventually got to talk to privately to the surgeon and said, oh, by the way, this is what happened to me. I floated out of my body and saw what you did, and the surgeon went bright red and confirmed what had happened. Now, that's the perfect example of a veridical near-death experience. It quite simply can't be explained. How could he possibly, in that deep anaesthetised state, having a brain operation, have seen that? So I thought, that was kind of like ambrosia for me after giving a talk that I was pretty nervous about to a bunch of psychiatrists. So that went well. But there is a shift, I think, in consciousness. There's a shift in the cosmos. There are more people that are curious about these things, and I'm just an example of that. So that's quite lovely.
Thank you so much for doing this.
My pleasure. Yes, it's a really good question. In most cases, I don't make the connection. We just do the past life regression, and if it's really helpful, then it will do its own job. You know, going back to that experience and the trauma of that experience often just relieves the physical. I had another patient who, she was a woodman who used to chop, and eventually had an injury which led to the amputation of her hand. He was a male. And again, she hadn't even told me, but she'd had chronic pain in her wrist all her life, and she couldn't explain it. But after she did that regression, the pain resolved and disappeared. So it's I think it's the experiencing of it and going back to it somehow is a source of causes relief, or the release of that consciousness or of that distress. But I'm very careful about not trying to explain it completely. It's a bit like Ian Stevenson's, you know, the children who have birthmarks related to their death in their previous life. How that works, but somehow there's a carrying forward of the consciousness of that event, which was the case with you, the dust and the scratching and all of that, and somehow that stayed with you and surfaced in some form in this life with your idiopathic urticaria. So I tend not to draw the link. I just, if it happens, it happens, and it's lovely. No, look, good question. I'm not aware of any specific, other than Brian Weiss has a training facility in New York where you can go, and a GP friend of mine went and did that with his wife, and he does it separately from his practice as a general practitioner, but he loves it, and I think what I do is legitimately part of the normal treatment range. But you're right, you've got to. It really is a case of incorporating all the elements, and and for sometimes the regressions are lovely and they're really quite powerful and they give a whole new perspective. Sometimes that's physical, that's sometimes psychological. I do love the ones where they go back to a lifetime that relates to some issue in their current life.
Exactly.
Just gives them perspective, like Tony, you know, where he went back to being poverty-stricken and losing his children. But it's, so I just think it's a case of combining where you see it as being appropriate. But yeah, no, Brian's is the only place I'm aware of where they do a 5-day workshop. Just those kind of things are just lovely, and I you know, in the end, of course, at some level, we probably all have the capacity to do that. I mean, that's the irony, and I think things like the past life regressions allow a bit of that to happen. And as Russ said, the psychedelics are going to have a bit of an impact in that same.
Just less than 10 minutes. Anyone have any questions for John? Now's your chance.
I'm still practicing, but I'm because I've been practicing for so long, I'm trying to slow down a little bit, and so that's why the books are closed. Which is, in the end, I said I'm not touting for business. I do make exceptions, and I do see, particularly if it's for regressions, because then the main issue is taking on new patients, and then you've often got them, you have to see them continuously and ongoing, and a lot of my patients are still very sick, of course, so they're not easy. But yes, no, the book's available on audio. There's no problem. Yeah, no, if you went to Amazon, you'd be able to get that, and of course it's available through bookshops, but they just have to order it in. So I haven't been very good at marketing it. So anyway, that's good. It'll be what it'll be. So
that's a whole other skill, so it's all right. Thank you.
Yeah, exactly. I will tell one brief story. I've got I was actually and this is kind of a nice one because it incorporates psychic phenomenon, and it's not in the book. I actually saw her daughter, and for whatever reason, she came into one of the sessions and we were talking about psychic issues, and she said, "Oh yeah, no, when I was in my 20s, I went to I went to Germany and to Berlin, and I think it was 1889, the time that the wall came down. Sorry, 1989, when the wall came down. And she said, it was remarkable. It was, she said, in Melbourne, I am always lost. I can never find my way around. And she said, I went to Berlin for the first time, and I knew everywhere I was going. She said, I was completely orientated the whole time. And she said, at one stage, a plane flew close overhead, and she threw herself onto the ground. And she said, I have no explanation for that. But my first thought, of course, was that she probably lived in Berlin during the war, and who wouldn't throw themselves on the ground. But she also described an event where she was living in an apartment in Berlin for that period, and her friends had given her a little bag of jewels, of crystals, as a good luck charm for while she was away. And she was off this day at a looking at an art gallery, and she said she looked at this painting at the art gallery, and she said all of a sudden, absolutely apropos of nothing, the painting turned into a video, and she could see her apartment being trashed. The door of the apartment had been ripped off. It was, to be fair, it was a pretty aggressive time because the wall was coming down. There were East Berliners coming in, and she said she could literally see them rip the door off the hinge and then go in and ransack all her things. And she said someone picked up her little sack of jewels and put it into their hand, looked at it and went, "Nut, worthless," and threw that on the bed. And so she raced out of the gallery and raced back to her apartment. And when she got back to the apartment, it was exactly as the door had been essentially ripped off. All her clothes had been thrown around, and there was the little bunch of crystals and jewels on the bed. So that's the kind of stuff people will talk about if you're open to it. And again, that it's not necessarily evidence. It's not, we can argue it, but the fact that we can't explain it doesn't mean it doesn't exist. And I'll stop to that. There's a lot of modern science that is just arrogant, and it's just silly. So we need to keep our minds open.
Agree with you with that. All right, one more question.
In the end, even after I gave that talk to the professorial forum with all the psychiatrists, in the end it was actually received pretty well. For whatever reason, people kept an open mind and were pretty. Now, to be fair, a lot of people know me, so they know that I'm pretty grounded and pretty solid, and and have been a good psychiatrist over the years. So they kind of, in that sense, they go, all right, well Weber's hasn't lost the plot completely. So there's a little bit of that. I'm very lucky because my wife, she's been very open to the whole idea too. So she's a bigger reader than I am. So she loves it. She's very engaged in it and loves, law of attraction, for example, and things like that. And my kids, I've got 4 children. Most of them are also pretty open to it. They're young, so they're busy doing their thing, but they haven't been dismissive of it. The immediate colleagues I work with, one of them's been very open. He's great, so he's been quite. And I tell a story about having gone off in the book about playing golf with 2 of them, and both of them having dreams that proved to be. I'll tell the story quickly. We went over to Queenstown. And we got there. When we first got there, we played a 9-hole course in Queenstown and got back. We were all tired, so we went off to bed, and we were playing at one of the lovely courses the next day. And when we got up in the morning, one of my colleagues said, "Oh my God, I had this really weird dream last night. I was in the motel room, and it was like this 2-story tsunami of water, like this huge wave." He didn't use the word tsunami, but he said it was like a 2-story wall of water coming at him. And that was the dream. And it freaked him out. So he had to wake up and go off and go to the toilet and go back to bed. And my other colleague said, he said, "Oh no, that's weird. I had a bad dream last night too, and it was like there were all these fires. They weren't normal fires, but I kind of couldn't put them out." And that was weird. And I said, "Well, I got nothing. I didn't have any dreams. It was fine." So we went off and played at Jack's Point, which is brilliant. And when we got back to the clubhouse, we looked up at the screen, and that night the tsunami had hit Japan and Asia, and the Fukushima nuclear power plant was in meltdown. And I remember looking at the guys and going, "Hello," who had the dream of a two-story wall of water coming at them. So my hunch is that they were connecting with that event. And one of those remains very skeptical, and the other one's much more open to the possibilities. So yeah, so it's been quite the journey. It's lovely.
Yeah, beautiful. Thank you.
Well, thank you, John. That was just so profound and expansive, and a good reminder that we're souls having many lives, and maybe one of our or a few of our past lives need the therapy, if not in this life. But it just gives me a lot of hope having someone like you talk about this. And like you said, our consciousness must be expanding and increasing, because
Exactly.
more people in your professions are going into the paranormal phenomena. So yeah, thank you. Thank you so much for your generosity.
Thanks for inviting me.
Time. Yeah.
Thank you, and thanks for inviting me. It's been fun.
Yeah, great. Thank you.